Here is a combined summary of the 2 pages. This research investigates the relationship between moral and emotional bases for attitudes towards COVID-19 vaccines and variance in stance on social media. The study evaluates nearly 1 million ex-users over a 2-month period, analyzing the language used in tweets about COVID-19 vaccines to understand antecedents of attitude strength. Moral values and emotions are found to shape how people process information and form judgments, making them crucial in promoting public health messaging, such as acceptance of COVID-19 vaccines. The study examines 3 research questions. Firstly, it explores how moral and emotional language is used differently in pro- and anti-COVID-19 vaccine tweets. Secondly, it investigates how moral and emotional language is used differently by users who indicate variation in expressed stance versus those who have no variation. Lastly, it examines whether users who include more moral and emotional language in their tweets about COVID-19 vaccines have more or less variation in stance towards COVID-19 vaccines. The study applies a lexicon-based methodology to detect moral foundations and emotions in tweets, and develops a classifier to label the stance of each tweet towards COVID-19 vaccines as pro, anti, or neutral. The results show that emotional language in tweets about COVID-19 vaccines is largely associated with more variation in stance of the posting user, except for anger and surprise. Furthermore, the strength of COVID-19 vaccine attitudes associated with moral values varies across foundations, with liberty consistently used by users with no or less variation in stance, and fairness and sanctity used by users with more variation. The findings have implications for designing constructive pro-vaccine messaging and identifying receptive audiences. Understanding moral and emotional antecedents of attitude strength can reveal which individuals are most receptive to public health messaging, ultimately contributing to more effective health campaigns. Here is a combined summary of pages 3 and 4. This study examines the relationship between moral values, emotions, and attitude stability on social media, focusing on COVID-19 vaccine hesitancy. The authors build upon existing research on moral foundations, emotions, and attitude formation, applying the moral foundation theory and Plutchik's 6 emotion model to analyze tweets about COVID-19 vaccines. The dataset consists of 2,283,281 users and 6,811,854 tweets collected between March 12, 2021, and May 11, 2021, using a streaming keyword search via Twitter API. The tweets were filtered to select those about vaccines, and users who tweeted only once during this period were excluded, leaving 913,416 users for analysis. A stance detection classifier was developed to label the stance, pro, anti, or neutral, of each tweet towards COVID-19 vaccines. The classifier achieved an accuracy of 72.8% on the evaluation data. The authors then applied this classifier to the dataset, obtaining 3,547,645 pro-vaccine, 2,928,820 neutral, and 335,389 anti-vaccine tweets. To measure variation in stance per user, the standard deviation of stance expressed across their tweets was calculated. Of the 913,416 users, 310,258 expressed a consistent stance, and the average standard deviation was 0.62, with a median of 0.58. Moral value and emotion extraction were performed using the NetMapper software, recording the number of concepts representing each moral value: care, fairness, liberty, sanctity, loyalty, authority, and emotion: happiness, sadness, fear, anger, disgust, surprise, in each tweet. The results show that anti-vaccine tweets contain more moral and emotional language, with significant differences in the use of purity, liberty, and authority moral foundations, as well as anger and fear emotions. Overall, this study aims to investigate the relationship between moral and emotional language and attitude stability on social media, extending previous research to consider stance over time outside a laboratory environment. This study explores the relationship between moral foundations, emotions, and the stability of attitudes towards COVID-19 vaccines on social media. The analysis reveals that anti-vaccine tweets contain more references to care, fairness, authority, sanctity, and liberty foundations compared to pro-vaccine tweets, which contain more loyalty terms. Additionally, anti-vaccine tweets exhibit a higher frequency of sad, fear, anger, disgust, and surprise emotions, while pro-vaccine tweets are characterized by happiness. T-tests comparing the use of moral and emotional language by users with no variation versus any variation in their stance show that users who consistently express a single stance tend to use anger, loyalty, care, and liberty more frequently in their tweets. Conversely, users expressing variation in their stance are more likely to use happy, disgust, surprise, fear, or sad emotional language and refer to sanctity, authority, and fairness foundations in their tweets. An OLS regression model predicting the standard deviation of expressed stance across tweets for each user, given the use of moral and emotional language, indicates that more emotional language is generally associated with more variation in stance, except for surprise. Liberty and loyalty are associated with less variation in stance, while the remaining moral foundations, fairness, sanctity, authority, care, are associated with more variation. These findings suggest that the moral foundations and emotions expressed in tweets about COVID-19 vaccines play a significant role in shaping the stability of attitudes towards vaccination. The differences in moral and emotional language usage between pro- and anti-vaccine tweets may reflect underlying beliefs and values that influence the stability of attitudes on this issue. Here is the combined summary. This research examines the relationship between moral foundations, emotions, and attitude stability on social media, specifically in the context of COVID-19 vaccine views. A regression analysis reveals that certain moral foundations and emotions are associated with less variation in stance, while others are linked to more variation. The findings indicate that anti-vaccine tweets tend to contain more moral and emotional language than pro-vaccine tweets, except for loyalty and happiness. The study finds that emotional language is associated with more variation in stance, except for anger and surprise. Fear, sadness, happiness, and disgust are indicative of unstable attitudes, suggesting that users may be less tied to their view once their emotional reaction is less salient. Conversely, anger is associated with consistent stance, while surprise drives belief updating by attracting attention to unexpected information. The role of moral language varies across stance foundations. Liberty is consistently used by users with no or less variation in stance, while fairness and sanctity are used by users with more variation in stance. Care and loyalty are associated with no or high variation, while authority is associated with some but low variation. The same moral value can play a different role depending on the context and individual differences. The results of this work inform how moral values and emotions associated with a belief affect the stability of that belief, with implications for constructing effective campaigns to promote vaccines and debunk vaccine misinformation. Promoting and tailoring pro-vaccine messaging to people expressing moral and emotional language associated with less attitude stability can help optimize public health outreach. The study is limited to a single social media platform, and future work should assess the use of moral values and emotions towards vaccine attitudes on other platforms. Additionally, the study did not examine the extent to which removing users displaying bot-like behavior affects the observed relationship between moral-emotional bases for an attitude and the consistency of that attitude. The study explores the relationship between moral values and vaccine hesitancy in Great Britain during the COVID-19 pandemic. It focuses on the role of moral and emotional associations with attitudes towards vaccines, examining how these factors influence stance stability over time. Using a dataset of nearly 1 million tweets, the research reveals that moral and emotional language is more prevalent in anti-vaccine tweets, with exceptions for happiness and loyalty. Emotional language is associated with larger variation in stance, except for anger and surprise, which are linked to consistent stances. Moral language's impact on stance variability differs across values, with liberty associated with consistent stances and fairness and sanctity linked to greater stance variation. This work highlights the importance of considering moral values and emotions in public health messaging, particularly in counter-misinformation campaigns. The paper also discusses the influence of policy change threat on financial contributions to interest groups, as well as the psychological meaning of words in computerized text analysis. It emphasizes the need for a more nuanced understanding of vaccine attitudes, acknowledging that they are often complex and multifaceted. By examining moral and emotional reasoning in attitudes, the study aims to identify receptive audiences for public health interventions. This research contributes to the ongoing discussion about the role of moral and emotional factors in shaping vaccine attitudes and behavior.